good morning. So what I'm going to be doing to start for probably about 30 minutes is just giving you some introduction about what are some of the challenges you are facing, give it some context, and then talk a little bit about some of the approaches, and then I'll call the panel up and we're going to go deeper through the panel discussion about what you can do to try and attend to your needs and the needs of your staff, and then we're going to have breakout sessions afterwards. I'll tell you about that at the end. So school leaders have been increasingly challenged by a broadening array of issues that schools as institutions are being asked to address, and this started well before the pandemic. Some of this is due to a growing recognition that children's emotional well-being is critical for learning, as was discussed in the keynote address earlier today. But perhaps it's as much to an acknowledgement of the limitations of other institutions in society in general to adequately address these needs outside of the schools. And unfortunately, the resources to address these needs have generally not accompanied these requests for support to schools. So initially, schools started by teaching kind of just core education topics, and then with better understanding of child development, started for a call for educating the whole child. But during the pandemic, I'm going to just say, in my opinion, the whole child has actually turned into sometimes just wholly unrealistic expectations of what you can possibly accomplish. And these challenges, I do want to preface it by saying they weren't caused by the pandemic and all the associated stressors that you're well aware of that came during this time period of increasing school and community violence, suicide, and substance use, the financial and staffing challenges, and growing political polarization, among many other challenges you've had. I don't think the pandemic caused that, but it certainly has made it much worse. And so a lot of these trends actually predated the pandemic, but they accelerated. What I'm going to show you now is just a clip that's about 90 seconds long, and they're actually two different principals who are going to tell you a little bit about what they went through when they tried to support a school after the death of a student.
It's just hard. It's hard. It's hard. I was a first-year principal, and in dealing with all of the other things that you deal with as a first-year principal, you know, then it's just like this big stop sign. It's like, what do you do? You know, how do you respond? When I first heard it, I was at home, I got in my car and I went straight to the scene. And they had already taken him to the hospital. And then I went straight to the hospital and sat in the hospital with the mother till like 3, 4 o'clock in the morning. You know, just to be there so she knew that somebody was there. And other staff started coming to the hospital and everybody was just in the waiting room, you know, kind of just being supportive of one another. And it was very hard.
We'll say that you never are prepared to be in an emergency room sitting next to a parent with no one else in the room and the doctor coming in and saying, you just lost your son. But yet I was there for that parent and I was glad I was there. But you know, textbooks don't talk about that when you go through your classes. And I think just being a compassionate human being is important to be there for people. So I learned a lot as a human being from that end of it. And I was glad I was there for that mom.
So I'm using that just as two examples. I mean, in both cases, these school leaders stepped into something that really was not their position and provided very important support. But as they mentioned, they weren't trained to do that. That was something that they just developed the skill set for, humanism, and were able to provide that support. And although I will just say, when they say there aren't books that talk about that, there actually are. I've read them, I've written one, that they are available. The real point is it's not integrated into the education for school professionals, including for school leaders. So what happens then is school leaders have to learn how to cope with crisis and loss while they're on a job, while they're already doing a lot of important tasks. And they, in turn, are somehow then expected to help school staff learn these new skills as well, while they're still picking them up. So school districts may have access to professionals from other disciplines to assist with some of these training gaps, such as some of the professionals you'll meet on the panel. But there's a growing list of in-service training needs. At the same time, there's a reduction in professional development time to deliver those needs. So a lot of what happens is what we call in the disaster field just-in-time training. I don't know if any of you have heard of that phrase. It's just called JIT. And so I want to kind of preface it by saying I don't actually think just-in-time training is in time. So I remember I was talking to one of the school staff who was in Newtown, Connecticut after the shooting at Sandy Hook. And his child actually attended Sandy Hook Elementary School and was there during the shooting and got exposed to a lot. And I think about 3 or 4 weeks later, his union had gotten in touch with me and asked if I would talk with him. So I spent about 45 minutes on the phone with him one evening, just giving him some practical advice. And at the end of the call, he just said, you know, this is the first time I've heard practical advice about how to support my kid. He said, I don't want to be critical, but I don't understand why the school district didn't bring someone like you to come and talk with us earlier. So I just said to him, well, the shooting happened on Friday, and on Monday morning I did a training for all the school staff in the district. You were supposed to be there. But there were probably one of two things that happened. Either you were home with your child, which I would completely understand after what you went through, or more likely you were there and you didn't remember a word that I said. And that's a common phenomenon, is people do not learn well in crisis situations. And they also don't remember things that are said to them or that occur. I remember talking to one school leader. He was getting very severely criticized by families of victims after a mass shooting. And they kept saying over and over, the superintendent, the district, never came and talked with us, never expressed their condolences. And separately, he looked at me and he said, do they not remember I was in their living room a day afterwards? And I looked at him and I said, no, they do not, and they're not going to. So the issue is people don't do best in crisis situations. There's this myth out there that crisis brings out the best in people, and we do see and hear about examples in the media, and I see them in person, of heroic and selfless behaviors among some people in the aftermath of crisis events. But I'm going to share a secret with you. That's not usually what happens. Crisis situations tend to bring out distress in people, and people who are distressed tend to be needy, demanding, self-centered, and they're just not fun or particularly satisfying to work with. It's challenging. And that's what you get when people are in crisis. I'm sure you were seeing it in the aftermath of the pandemic. You're probably still seeing it now. The other thing is that school leaders are people too, and so they usually aren't at their best either, because crisis is distressing to everyone. So people in crisis situations need certain things. So one thing they need is information that they can understand and that they can trust. And for various reasons, which we can talk about separately, they were not receiving this during the pandemic. There was not clearly presented, consistent information from a trusted resource. So they then turn to school leaders and they demand more information, and then at the same time they question it more. So they're going to ask you, why are you reopening? What are you doing to keep us safe? And you're trying to explain it to them, but a lot of that was not part of your training either. So as a result, I think administrators tend to, in the aftermath of crisis situations, whether it's their staff or whether it's families, is to limit communication. You really don't want to hold a meeting where everyone just yells at you during the meeting, and it doesn't seem like people are better when you're done with the meeting. So by limiting the conversation, you actually make matters worse because people really need to process and talk through their concerns. The other thing is that people who have been through a crisis event tend to feel powerless during the event, and they will demand more influence as soon as they feel there's an opportunity for it. So I was doing a lot of training starting in April of 2020, particularly with the New York City Department of Ed. And I predicted at that point that as soon as people start to talk about reopening schools, you will get many people, your staff and the families, who will have extremely strong opinions about exactly how that ought to be done, and they will disagree with each other. And that will not slow it down. They will just become more fervent, more adamant, and more demanding about it. So that makes it difficult. And so the other phenomenon that you see is that whether it's staff, students, or their families, if they're impacted by a crisis, they may actually opt for guilt or anger rather than accept something might be outside of anyone's control, including even school leaders. It's often easier to feel guilty or angry rather than to feel vulnerable or helpless. So what I see in school crisis events, no matter what they are, is often a demand for change, and often that demand for change gets focused on the administration, and they feel even more attacked and more vulnerable. And leaders are often blamed for failing to fix problems that are just inherently unfixable, and the expectations of family, staff, and administrators themselves are often unrealistic. So that's kind of a little bit of the background. So what do you do about that? So first off, you need to provide support to all of the staff. But we should realize that even if you've had the same crisis, doesn't mean that it's equal stress for everyone who's been through that crisis in your building or in your district. So we all lived through the pandemic, but the nature and number of stressors are actually quite variable among people in the US population. Just as students bring to school the stressors from their homes and communities and the trauma and loss experience that they experienced earlier in their lives, they bring that with them into the school. The staff arrive with the same needs and challenges and the same diversity. But they actually have longer life histories and they have more responsibilities outside of school, and therefore, on average, I find they have more to deal with than the students do. So it's actually more complicated for the adult staff. And even those who may appear to have similar experiences may actually have different levels of pre-existing and concurrent trauma and loss. So for example, the impact of racial inequities in our country results in this intersectionality of a current crisis with an unequal burden of other stressors that are experienced by traditionally marginalized groups. So, and individuals often have different baseline resiliency and coping skills and various levels of external support. And as a result, two people experience the death of a parent due to COVID may have a very different experience, even if their relationship with their parent was similar. And school leaders just can't be expected to know the burden that each of their staff members face. I remember I was called into one school. They had actually had a mass shooting in the community of recent graduates of the high schools. My students had graduated. One of the kids they had a party. One of the kids bought an assault weapon, read the owner's manual in his car, and then went in and murdered several people with the assault weapon. So this was, of course, very, very stressful for the school. So I went in and I did training for the entire school several months later, just to talk about how to support kids around crisis and loss. It was part of their pre-service training before they opened in August. And after that training was done, one of the teachers talked to the principal, and the principal came up to me and he said, "One of my staff just told me that when he was a child, his father murdered his mother and all of his siblings." He said, "And I never knew that about him." And he was a wonderful principal, and he was very connected with his staff. And he said, "How can I not know that about someone I work with so closely?" And I looked at him and said, "Well, most people don't put that on their resume or bring it up during the interview." And he said, "Yeah, but I worked with him for years." And I said, "How would you drop that into conversation at work?" So the only reason it came up was they had gone through 4 hours of training on this topic. And so then the staff member felt, okay, we're discussing this. And he went and shared that with his principal. And so I think that school leaders can anticipate everything that people bring to them in terms of their experiences. And then they have a layer of responsibility that I think is just burdensome after a crisis. So this same administrator said to me after we had finished the training, I had talked a little bit about some of the guilt that people feel after crisis events. And he said to me, I didn't talk with anyone about this, but about 2 or 3 years ago, we had 2 or 3 students who died by suicide. And he said, and there were several of my staff that said if I was a better principal, maybe these kids would still be alive. And he said, I've had to live with that guilt for 2 or 3 years. And he said, I don't understand why you weren't here beforehand. And so the issue is, you have huge burdens. Now, we're not going to just leave you with all that distress. We'll try and figure out about how to talk about that. But let's talk about now, how do you take care of yourself? Well, many of the typically kind of spoken about tenets of professional self-care, the get a good night's sleep, eat a healthy diet, exercise regularly, I'm sure you hear them all the time. They are important. We heard about that in the plenary that preceded this. But they're actually hard to accomplish, particularly for administrators when they're in the middle of a crisis event. So it's hard to do even in the best of times, and we're not in the best of times. So I remember talking to one superintendent during the pandemic. She had actually had a couple students which murdered one of their teachers. And so we were coming to the school to visit and try and see if we could support the staff. And I was talking with her the day before I arrived, and she was going over, what the itinerary was. And she commented that she hadn't gotten back home to sleep until after her meeting ended at 10 o'clock the night before. And she just kind of mentioned in passing that there was a blizzard that had occurred, and as a result, she had to get up at 4 in the morning. And I'm like, why did you wake up at 4 in the morning? And she said, well, I had to drive the roads to make sure they were passable to decide whether or not to cancel school. So I'm like, that's a lot on your plate. That's a lot for you to do. And then she's talking about the itinerary, and she's, talking about we have some wonderful restaurants in this community, and she starts to recommend some restaurants. And I said, well, we're really not there to eat, but which one do you recommend? And she goes, well, honestly, I haven't eaten at any of them. Now, that is what I always get from school leaders, is they will recommend things, but they've never been able to experience them themselves. So I just came from a district that had a school crisis event many years ago, and we were doing some follow-up, and I know to say to them, okay, I understand no one in the district office eats lunch, but I actually can't go all day without eating, so could you just schedule a break for me? And they're like, yeah, we don't eat. So that's not good. Now, that's what they do all the time. So I think we just have to realize that we can keep telling people these are the things you ought to do, but sometimes you don't have the time to do it. That doesn't mean you shouldn't, but it's just really hard. Now, people actually have a complex range of stressors and individual needs. As I said, how each person responds to a crisis is very different. And people have different coping strategies, abilities, supports, and resources. So what works best for you is going to be different than what works best for someone else. So before you practice professional self-care, effectively, you have to start with introspection. You have to figure out what the personal impact of the event or events is having on you, and then you have to have a menu of resources and strategies and match up what you're going to do with what you know that you need. Now, institutional and organizational supports for professionals are actually more effective than sole reliance on individuals to conduct their own self-care. But this requires a change in school climate and culture and some prioritization and allocation of the needed resources. Otherwise, I'm a developmental behavioral pediatrician, and within the medical field, there's a lot of talk of physicians needing to practice self-care. But sometimes it actually becomes that we blame professionals for not taking care of themselves and managing their own personal stress, when in fact, they're being placed in inherently stressful positions. And we really have to improve the work situation and the profession so it isn't so inherently overwhelming. When we suggest that stress is due to incompetence in self-care, we actually make matters worse, and we make people feel overwhelmed, helpless, and angry, and that will increase stress and ultimately burnout. So what we need to do is set up a culture and work environment where individuals can communicate what they need, even though sometimes in the work environment, or often, you're not going to want to communicate why you need it, and that's okay. You should be able to ask for someone to do something for you because of a personal issue or a family crisis, but you don't actually have to talk about what that crisis is if you want to preserve your privacy. So I'm going to give you a couple examples from my experience in the medical field. We did some workshops on how to cope with patient death, and I remember one of the oncologists shared that what he would do is whenever a patient died, he would call home and suggest to his wife that they get takeout pizza. And takeout pizza was just code. And she knew that that meant a patient had died. He didn't have to talk about it, who it was, why it was bothering him. And then she wouldn't ask him to do anything else. She would just she'd just get the pizza for him and be with him. So that was the way they communicated. So I'm going to share something that I did in my residency. I'm not proud of it. It was kind of silly, but it actually worked. So when I was starting my residency, they had just introduced a pediatric bone marrow transplant units in the United States in children's hospitals, and our hospital was one of the first that had it. And they actually opened the unit on the day I started my pediatric oncology rotation. And it's much better now, but at that time it was not very effective, and it was very difficult on the kids. And we had so many deaths on the unit that month that we actually started rounds in the chapel with a moment of silence. Actually, I thought that was very respectful, although really we needed to talk about it, not just be silent about it, but at least it was a recognition. Well, what happened was at that time I used to have a pen topper, just a little Odie that I put on the edge of my pen so that when I was trying to engage kids so that I could get them to point to things and move their eyes, they would follow Odie. We now call them fomites and we don't allow them, but at the time that's what I was using. Well, what happened was a lot of kids pointing to it and touching it. Odie got a little grody and I needed to get a new one. So I was on call, so I went to the gift shop in the hospital and I bought a number of them. But I didn't have a locker. I was on a 36-hour shift, and I was just wearing scrubs. So there wasn't really any place to put them. So I just grabbed a couple pens on the ward, put ODs on each of them, and stuck them all in my pocket. And in the morning, the senior resident looked at me, and he said, "You usually have one OD. Why do you have 4 today?" And I was just being sarcastic, and I just said, it was a tough night. It had nothing to do with the ODs. And so he said, "Oh, okay, well, we'll make it easier so you can get out on time and get some sleep." So from that point on, I communicated my status through ODs. They'd come in and they'd say, "Oh, it was a 1 OD night." And I'd say, "Yeah, I got 2 hours sleep, no one died, it was really great." And then one day I put 5 of them out. And I just remember the look on my senior resident's face when he started rounds, and he said, "I can't even imagine what a 5 OD night is. Hand over your beeper, we're covering for you, get breakfast, get a shower, do what you have to do, we'll take care of you." Now, was that a silly way to communicate it, that I need help? Yeah, but it's better than not communicating it. So I think what I would tell you is figure out how you're going to let people know you would like some help, and then accept that help. And we have to figure out how to have those types of communication. It doesn't mean we have to share all of our deepest secrets, but we do need to share when we need assistance. So what I wanted to do is the next part is just mention some of the challenges before I call up the panel. So there are many challenges to successful self-care for professionals in school setting. One is making time when there's so much to do and everyone needs your help. I have actually never found time. I've lost time, but I've never found it. So you can't wait for it to appear. It's not going to happen. And I've long ago stopped saying when I get caught up, because I'm never caught up. So you just need to make time. Another challenge is feeling shame or guilt for attending to your own needs ahead of those of others. But as Len had already mentioned, you have to recognize it isn't about putting your personal needs ahead of others, but rather attending to your own needs so you have the capacity to help others. If you see it as an investment in your resources to help others, then I think you'll be more likely not to see it as selfish. There's also this assumption that others are having less trouble adjusting than you do. But to be quite honest, children, for example, do a very good job of hiding their distress. Adults do it even better, and school leaders really do it well. I'm going to tell you that's not a superpower, it's a problem. We really need to be able to express when we're having some distress. And there's also a lack of modeling of professional self-care by those around you. You should practice self-care and share what you're doing to care for yourself so that you can become a model that will encourage others around you to do the same. I remember talking to one principal. She was in a school that had been in a community that had a really large natural disaster that had killed some students and destroyed a lot of the property and homes. As I was talking with her on the first day back to school in the fall, she shared with me that her home had been destroyed, and she said she was living in the basement of her mother's home. And I looked at her and I said, "And how is that going for you?" And she was really an incredible person. She looked at me and she said, "There were many legitimate reasons why I moved out in the first place. They persist." That's all she said. And I was like, okay, I get it. And so I said, "Well, what are you doing about that?" And she said, there's nothing I can do. I got divorced right before this happened, and so I don't really have a partner to help me. I have financial concerns. And she said, "There's no property that's left that's undamaged." And then she looked at me and she said, "And what type of message would it deliver if I left school to go look for a home?" And I said, "It would deliver the message that you are taking care of yourself and you value self-care and appropriate support, and that would allow some of your staff to do the same. But if you don't do it, they can't." And I just said, "You're not going to be a very effective principal until you literally and figuratively get out of the basement. You need to take care of yourself." So I think it's hard for leaders to do that. They have a number of other challenges. One is that no matter what you do or how well you do it, you just have to accept you're not going to be able to make everything okay. So you need to try to stop judging yourself and your efficacy as a leader by whether people seem to be happy or unhappy. They're going to be unhappy. So you have to identify other ways to assess your performance rather than positive feedback or general public or overall approval. So I remember I was early on in the pandemic in the spring of 2020, I was talking with an administrator in New York City Department of Ed. I did a lot of work with them. And there had been a principal that had suddenly died, not from COVID, but from another cause. There was about 5 weeks left to school in the spring of the first year of the pandemic. There was no vaccine in sight. They didn't know if they were going to come back. There were threats that they might be major budget challenges, so they thought that they were going to lose 3 counselors for budgetary reasons in the school. He didn't know whether he had to reopen the school, would reopen the school, how to assign people to classes, whether they would be assigned for classes, and he had never done it anyway. So as I'm talking with him on Zoom, he looks at me and he goes, "Morale is poor." And I looked at him and I go, "Yeah, I would imagine it would be. There are a lot of people dying around you. That does tend to take a hit on morale, but this sense that somehow he was failing as a new school leader because people were upset. And I think that's a burden people in leadership place on themselves when it's really just not realistic. What I did hear from, I don't think it was just in New York City, was that one administrator shared with me, we call each other up in the morning. I said, "What do you mean?" And he goes, "We call each other to say, you have to get out of bed." And we say to each other, "I don't want to get out of bed. I don't want to go in there. I don't want to do that job. I don't like it there anymore." And they go, so we coach each other each morning. You got to do it. Got to get up. Got to get out of bed. So that's where people were at. And so, yeah, it was difficult. As I already mentioned, those who are impacted by a crisis take it out on leadership because they try and exert more control. And people will have different views about what should be done and feel strongly about those views. And usually, in my experience, they're in the areas of safety and security. We saw that in the pandemic. I see it with school shootings. The timeline for returning to academic or work focus if it's your staff. How to use donated funds or limited and constrained budgets. Budgets are always limited and constrained. It's kind of redundant to say that. And then in other types of crisis events, I see conflict around commemoration, memorialization. And communities in general, and school communities especially, are highly polarized since the pandemic, so they have even higher levels of conflict, which makes leadership even worse. You also have to realize that your staff are reacting to the same event, and that challenges their working relationships. So your team members may be least available to help you when you most need them, and that's why you have to kind of use more shared governance and help each other. And then, of course, you don't have the opportunity to stop and just focus on recovery. You have to do everything else you did before. You have to worry about everything else. And so sometimes it's useful to adopt a recovery coordinator. We do this after school crisis events, and we're now working with some school leaders in one part of one state to talk about how they can create a recovery plan or actually a renewal strategy, because I'm telling people they should probably focus on renewal rather than recovery. Recovery is where you try and get back to where you were. Renewal is where you try and go where you wish to be. I don't know that we want to put all of our effort into getting back to where we were, because as I said, there were problems before. So maybe we should be thinking of renewal, but that takes someone who can lead that. And you might wish to figure out how you can appoint someone to do that. So it's important to realize that even if you want to be a superhero, even superheroes have to attend to their own personal needs. So Batman actually spent most of his time as Bruce Wayne attending fancy dinner parties. I never figured out how he had the time to do that. Superman had ample time to date Lois Lane, who was apparently pretty high maintenance. And the Lone Ranger had more than sufficient time to go horseback riding, which I never find the time to do. Being heroic is actually exhausting physically and emotionally, and at times overwhelming. And there really is only, if you think about it, there's only one classic hero who is always seen smiling in pictures. You may not identify that, but it'll seem obvious soon, and that's Flipper. Flipper is the only one who smiles all the time, despite all of his challenges. But I'm going to share something with you that I read, that Flipper was not actually that happy. And in fact, once the series ended, they felt that he became clinically depressed, and according to the trainer, thought that led to his death. So even Flipper found trouble. I'm going to ask the panel to start to walk up, because we're going to talk about, well, what can we do about that? So I think you have to recognize that self-care and professional support are important, and hopefully I've already set that framework. Then we have to acknowledge that self-care isn't simple. So you need some introspection of personal needs and strategies that will be most effective for you personally. And so we're going to talk about some of the personal impacts of crisis in general and the pandemic specifically on school leaders, and strategies that leaders can use to address these impacts for themselves. And so one of the presenters, the first person to my right, is Alma Lopez. She's the ASCA School Counselor of the Year, and she'll be talking about some of those individual strategies. But as I already mentioned, institutional support is actually more effective than personal approaches for self-care. So we're going to outline some of what we know about system-level approaches. So all the way on the far right, my far right, your far left, is Dr. Nathaniel von MC, who's an associate professor of school psychology at the University of South Florida. And it always sounds easier than it is to actually carry this out. So on the panel, we have an administrator to help ground us in reality, and that would be in the middle of the two speakers, Clarence Allen, who's a principal in Newark, New Jersey. And we know that this panel discussion is just going to start the conversation, and we hope that each of you will take some time for personal reflection, not just now, but really you can stay and join us for one of our two deeper dive sessions upstairs at the end to talk with us about, to continue the conversation on this topic. But we hope that you're going to talk with others, your colleagues, during this conference, and that you'll go home to your own school and community, and you'll continue the discussion there. So I'm just going to, this last slide is just contact information for people that would like to speak directly with me, and I think if you can bring the microphone for me, I will join the panel over there. All right, well, I'm going to welcome my panel. Thank you for waiting. They had the cue to come up when Flipper was called, but I did not tell them why. Hopefully they didn't find that too jarring. So what I'm going to start with is Alma. I outlined a number of challenges that we're facing school administrators that can just make it very difficult for them to attend to their own professional self-care. So I'm going to ask you two questions. Can you share some strategies you've seen administrators use that you felt were particularly effective for providing professional self-care? Or can you identify a particularly challenging issue that you've seen school administrators address well in order to be able to provide that self-care?
For sure, thank you. So first of all, just being able to get called up here when it said Flipper, you know, my anxiety was a little high about coming up here. I'm not usually a panelist, so this is a new opportunity for me. So just kind of having that broke the ice and made it comfortable. And so as leaders in the building, when you're having meetings with your staff, just bringing in a little bit of humor really can go a long way. And the first thing I really want to say is that you all as principals and administrators are my heroes. You're absolutely my favorite people. As a school counselor, I recognize that you are the decision makers and the risk takers, right? And that is a very big job. And it's such a big job, and Dr. Schonfeld alluded to it earlier, that most people outside of education don't actually really understand. If you have a school with 1,000 students, you're not only in charge of those 1,000 students, but let's just say they have 4 family members, right? And those family members, they're sending their number one love to your school, to your building, and they're concerned about their child. And so you have them to worry about and think about as well. You also have the community, right? People outside of the school. And then, of course, your staff. And with COVID, right, that was a lot of questions that came up about your own health, our own health. Are we going to be okay? And so one of the things that I want to make sure to kind of start off with is you have a lot of responsibility, right? And you know this. And it's absolutely important that, like our morning speaker said, you put that oxygen mask on yourself first. And so there's a few things that I would suggest. The first thing is accept that your work is hard. It is. So just accept that and know that kind of going in. And as you were sharing the example of, you know, calling each other and saying, hey, get out of bed, you know, it's hard and it's tough. And sometimes you need to find those people who can serve as your cheerleader, as your coach to help you through the day. And so making sure that you find those trusting people in and out of your buildings to make sure that they help you through and support you. Trust is such a big deal. As a school counselor, I can tell you I've worked for over 12 principals, all very different people, but I've had each of them at some point in their career come in, close the door, take a deep breath, and say, oh my gosh, Alma, let me tell you this, or let me share this. And so as a school counselor or as a school psychologist, know that you have people on your campus that are trained listeners, right? Sometimes we just want to take a moment, and you have people in the building that can help support you through that, but also reach out to your own insurance companies, right? There's other people, professionals, that can also help you. And lastly is just be joyful in all that you do, right? We just had a tough conversation, and we talked about Flipper too, right? Let's bring the joy in when we can.
So great. So yes, so finding individual supports that you can call on and surrounding yourself with those people, I think, is particularly important, and then respectful humor. And it's always a challenge to know when you're crossing the line, but you can use your same people that you seek for advice to say, did that go too far, or was that useful? So thank you. So I'm going to turn now to Clarence. So I would like your reflection on this, and what have you seen school administrators do effectively to provide self-care? And you can tell me what works, whether you've used that strategy yourself or you've seen it used by someone else who's a school administrator.
Good morning, everyone. One of the things I would say is that I think, as you were giving examples, Doc, earlier, we can't miss out, what people do. Like some people need a glass of wine. Can't forget that, right? So I think that, at times we have to put ourselves in situations to say, how good was the day? How well did we respond to that particular crisis or that particular situation? And sometimes we have to also understand that we didn't do a good job, right? And so what happens next? So similar to, I'm an avid baseball fan, I think similar to baseball, you got to forget your last at bat. There's 182 days in most school years. We work probably as administrators 212 because we're 12 months. You're not going to have the best day every day. So what do you do to reflect on that day? Some of us work out. Some of us go for walks, go for runs. I seem to have this thing with my staff, there's 3 or 4 of us, the clerks, which allows us to debrief over a 20-minute lunch. That's all I get every day. It's not like I get an hour. So over a 20-minute lunch, we just debrief. And I talk to them about whatever's going on in my life, not only school-wise. So sometimes I think that I've done a good job, but sometimes I haven't, and I need that. I have some colleagues even in the audience that I speak with regularly from our union, we have these cohorts of SLTs, we call them school leadership teams. And we speak regularly, just say, hey, I did this today, what you think? What was your take on that? Because we need to understand that we're not going to be successful all the time. And that's hard to do as a professional, because everything in that school comes to you, right? When I first became a principal, I think one of the best advice that I got is that, you're now the last person who leaves, even stay there later than custodians. So at that point, you realize that I'm the person who cuts off the lights. I'm where everything comes to. And it's hard to think about what's going on in the rest of your life. I guess my last point to you is this. I remember recently my son, who's graduated high school, was going to the prom. And I was going to get there right on time, right? And so I'm sitting in my office trying to finish a presentation for the next day. And I look up and my 2 clerks are standing in front of me it's time to go. And I'm like, I'm leaving. No, it's time to go now. They have passed me my keys. They put me out. They kind of you need this for you. You understand what I'm saying? So at that point, you need people to help and assist you in caring for yourself. And I think we work on trying to do that as best as possible.
So some great things. So thank you. So part of what you talked about was a little bit of humility and also recognizing you can't do this perfectly. I remember I was responding to one very large school shooting, and I was supposed to be observing the first time the staff had gotten back together since they left the building. And at the last minute, I was just told I'm running the meeting. And I had just arrived from out of state, and I started to introduce myself, and I started getting attacked because I was seen as a proxy to the leadership for the school. And I did my best, but there was one person who said, we don't want outsiders. We want to be with the people we love. And I didn't realize that was the first time they had seen each other since they ran out of the building. It was very emotional. And so afterwards, I said, okay, I completely respect that. And I asked, is it okay if I stay in the room? And she was like, yes. And then she came over and hugged me and said, I'm sorry, I didn't mean to take it out on you. But I turned to one of my colleagues, Because at this point, people were observing, the administration was observing, the FBI were observing. I mean, it was really very high intensity. And I just said, did I handle that okay? And my colleague just looked at me and said, oh yeah, like you were attacked. That was gonna happen to anyone. Anyone who walked up there was going to be attacked, but it never feels like you did a good job when you're in that situation. I feel like, oh, did I miss something? So you again need to be able to ask other people, as you said, you called it debriefing, but some of it is just sharing to be able to, because you probably are doing much better than you think you're doing in some of those situations, and sometimes you won't be doing it perfectly, and they can give you advice on how to do it better. And I've done the same thing your friends did. I remember with one school that had a large mass shooting. I was there maybe 6 months afterwards, and I just said to the person coordinating the response, I said, my guess is you have not taken a single day off, including the weekend. And she said no, and I said, okay, look, my plane is going back home tomorrow, but I will not get on that flight until you book a 3-day weekend that you're off. And I said, and I will go to your office, and I will sit there until you've scheduled it. And I went to the superintendent, I said, this person hasn't even taken a weekend off. What's a good weekend? He said, next weekend? That's fine with me. And then I turned to him and I said, I'm gonna come to you next, I just don't know you well enough. And the same thing. And I remember she just immediately picked up the phone, called her office. She said, Dr. Schonfeld told me I have to take off next weekend, so free my schedule. And her assistant gladly did that. So it's good the fact that you have people that would do that for you is not a sign of your weakness. Of course, it's a sign they care about you, which shows that you are an effective leader. So be that person, but also accept that support as well. So that's great advice. So now I'm gonna turn it over to Nate now. I already said that I thought institution and organizational efforts to promote the well-being are even more effective and important than relying solely on individual approaches. We have to do the individual approaches as well. So what have you found that are the types of supports that are most helpful from an institutional or system level?
Yeah, that's a great question, David. I think there's been a tremendous shift in our narrative. I've been doing this work for well over a decade and working with schools all across the country. And 10 years ago, we might have had that whisper around mental health. I'm not quite sure we're at the shout yet, but it's certainly that change is present. So as we kind of shift that narrative, it becomes much more kind of part of our conversation around educators, this conference certainly being a great example of that. The question then turns to is like, how do we go from kind of our personal needs to what is a system that's going to be facilitative of not just reducing mental health problems, but facilitating mental health wellness. And I think that's really an important next step when we're having these kind of conversations as educators. And so, you know, I would ask you all is when's the last time you've all had a checkup from the neck up, right? When are you thinking about kind of your own mental health needs? And then how is that modeled to your staff, right? My wife and I are both school psychologists. We have a 6-year-old and a 10-year-old. And they're, believe me, that does not make us better parents. It just makes us know when we screw up more. And so when there's that time where I know I'm reinforcing that bad behavior, that tantrum, and I'm like, what am I modeling to my kids, right? What do they see from me? I think as educators, we consistently underestimate the emotional intelligence of our children. As school leaders, what are we modeling to our school staff? Are we modeling that it's okay to talk about these things, to break down these kinds of barriers and make it part of the conversation, shifting that conversation to not just problem reduction, to how are we thriving as educators? So I think that's a very important first step. Certainly we can talk kind of much more about these kind of school-wide strategies.
So thanks. So what I'm going to turn to you, Clarence, for one or two things. So you can pick which one you want to do, because I'm keeping track of the time too. I want to make sure we end on time. So you can either talk about what examples you have of schools or districts that you thought did a particularly good job at providing support at an institutional or systems level, but I'd also like you to talk about AFSA. So AFSA, I think, was not only brave, but actually very thoughtful of putting this session together and giving it this level of visibility. So I've worked a lot with AFSA over probably the past 9 years through the Coalition to Support Grieving Students, and what I found that this is something that they truly care about at a very sincere level. So what do you think AFSA can do in this regard as a professional organization?
Okay, so I'm gonna deal with the first part first, right? So I think that I'm gonna give kudos to my own district, Newark Public Schools. They offered, workshops on anxiety, depression, mental wellness for all, like for staff, both administrators and for teachers. And a lot of us took advantage of it. Being that, I'll say a lot about myself, the arrogant male, Leo, administrator with this bravado, right? I don't think that I was even abreast on the mental health of others and myself. So going to those workshops, attending those workshops, and allowing me to see my own vulnerabilities, my own weaknesses in those particular areas actually allowed me to help other people when they come to the office. I have one of those, what do you call it, open door policies, so to speak. So staff comes, they tell me what's going on. I'm like, oh, okay. It adds an extra burden to me, however, but I know how to deal with it. I know what they're going through. So if they tell me that they're absent for the next 3 days, it's not, oh, just Jackson's taking off. It's more Jackson's going through something. You know what I mean? And then I have to make a call to say, hey, Jack, how did it go? How did the surgery go with your mom and stuff of that nature? So the district did a very good job of allowing us to have those places. Funny, as I said to you earlier, how you can say to, you're able to say to strangers things that you can't say to some of those who are close to you, right? We'll call someone and give them all of our history, and your friend who's been your friend for 20 years don't know all of that stuff about you. So it's interesting how we do that, even as professionals. So I think my district has done a great job of allowing that space, allowing series of conferences and staff development in order to improve your own mental health and understand how you self-care. As far as AFSA is concerned, I think that what we're doing today, I think they took as you said, a great chance in putting this thing together, having this conversation, choosing me. Thanks, Lenny. Only because I'm not a sharer. I'm doing better. I'm doing better, but I'm just not a sharer. I have conversations, but I don't know if I share even all the things that go on well at my school, that we do well, that we don't do well. You know what I'm saying? I think it's easier for me to be critiqued than to me to come to you and say, hey, I'm doing all of this stuff. So I'm not a Twitter, Instagram, and all that other stuff that people do. I don't do that. So this is very big for me, and I appreciate the opportunity. Probably rambling because I'm nervous, but so I think that as for allowing this conversation, creating forums for people to talk, the web page that we're using now, the app that we're using, I call it the web page. But I think that type of stuff, allowing people to be able to dialogue about what's going on in school, what's going on with your mental health, what's going on with you mentally and professionally, which allows us to just grow.
Great. Well, thank you very much. So in the interest of time, what I'd like to do is, we're asking administrators. I started out by saying administrators already have an overwhelming job. Then it got worse. So whatever is beyond overwhelming is what then occurred. And now we're saying you need to think about how to take care of your staff and take care of yourself even more so. So that's a lot. And I don't want to add to an overwhelming list of things to do, but it is important. So I'm going to ask each of you if you had one or two things that you wanted people to take home from this, and you can be brief, you can talk a little bit about it, kind of a take-home message. So we'll kind of summarize in that way, and then we'll talk about the breakout sessions that follow. So I'll start with you, Alma.
Okay, so to your point, Clarence, I think that principals don't usually get asked, how are you doing? So one of the takeaways is making sure that you find that trusted person within your space in and out of the building that you can answer that question honestly, genuinely with. I think that's so critical. And then as a leader, also finding those people in your team that probably need that question asked. And a lot of times, that's not somebody that you're going to look forward to going and asking, how are you, right? I know even as a school counselor, this last year, I was very intentional about the steps that I took, and I looked at, I am at a 6-8 school, and I was like, okay, I'm going to find one teacher in each grade level, and it's not going to be that teacher that always comes in with a smile, right? It's going to be that other teacher that probably needs that question asked. And so making sure someone asks you how you're doing and you answer, and then that you also do that for someone else. And the second thing, and I think to Nate's point that he was talking about, is being able to process absolutely does a few things. First of all, I think that it helps you. When we talk and when we process in written word or verbal, that's helpful to you. Number two, I think that it helps us lower and lessen that stigma on mental health, which is so essential in this country today. And then third, I think, as Dr. Schonfeld mentioned, you're modeling that to your staff. So when I ask my principal how he is and he says okay, I'm like, no, you don't look okay, right? But when I ask him, how are you, and he tells me, then I'm like, okay, we're gonna be okay together, right? Because there's this trusting relationship. So those would be my takeaways.
And if I could just reinforce, helping others is a very good way to help yourself in crisis situations. They used to talk a lot about kind of burnout and compassion fatigue, but actually compassionate care is what makes our work meaningful, and that's actually that decreases burnout if you feel you can do it effectively. So if you can effectively help someone, it actually helps you a lot in your own recovery. So thank you for highlighting that. Clarence, anything you want to sum up with?
I would want people to take away, how you take time to reflect. There are some practices that we do, like one of my daily things is my little 10, 15-minute walkthrough where I walk to every class, speak to the kids, speak to the teachers, some old school elementary stuff I know some of you like, but it works. It allows me to see people at work, see what they're doing. I also take time to reflect. I want you to understand that reflection, I ask 3 questions of myself. It is, how was today? What can I do better tomorrow? And then move on. Move on means I might not have done a great job, or if I did a great job, something else will come up tomorrow. And when it does, I gotta attack it. So again, that reflection isn't always about, praising or criticizing. It's more about, where am I? Again, making the connection to what we do in life in our sports and our habits with our kids. Just make sure that you make the correction today, because sometimes tomorrow never comes.
So thank you. Great advice. One thing I'm going to just add for you to consider, because I know this happens with physicians, we call them huddles. We get together, we say, what's the current situation? What do we need to do better? What do we need to change? We've started to add, what can we celebrate that we did effectively? So there's a certain amount where you have to kind of specifically ask. You have to pause in the middle of a crisis and say, what did we do well? So you know to continue it, but also so you can enrich yourself with it. So it's great advice. Nate, what's your suggestion?
Yeah, I think all of kind of how we spend our time are value statements, and that certainly applies as a school and organizational culture. And so I've yet to meet that school leader who says, you know what, I've got so many days, how am I going to fill this with PD, right? Still no one. Okay, so if it's going to be perceived as kind of one more thing, or how do I squeeze this PD in, that's an implicit and sometimes explicit message to your teaching staff, right? It is one more thing because we're just kind of adding it on to the end of our PD calendar. And as we shift this narrative to that there's not an academic kid and a behavior kid and a social emotional kid, it's the same thing with all of us. And so if we're just truly, deeply, and meaningfully embedding this into our school culture, it has to be reflected in how we prioritize and spend our time.
So great. So we have just a few minutes left so that we keep you on time, but I thought we would just maybe get a little input on what are the sessions that are going to follow. So we have 2 breakout groups, and the description of the breakout groups in their room assignment are not completely accurate in your program, so please pay attention if you're planning on attending one of the 2. So one is to go a little bit more into the individual strategies for professional self-care. What can we do as individuals? And Alma and Clarence are going to be doing that, and that's in Flamingo C. So C is in Charlie, Flamingo C. The second one is beyond the individual. That's how to create a supportive culture and organizational structure to promote staff wellness in your school. And Nate will be joining me, but we'll also be joined by Irene Hightower, who's an AFSA member and a principal in San Diego Unified School District. So she will be joining us there to be our administrator on the team, and that's going to be in Flamingo D as in Delta. So the individual session with Alma and Clarence is going to be in Flamingo C. These are both on the second floor. And the organizational or institutional approach that Nate and I will be doing with Irene is going to be in Flamingo D. So what we have just about 2 or 3 minutes left. So I'm going to invite either Alma or Nate, if you want to talk like a sentence or two or a minute about something you plan on bringing up in that group, I'll give you that opportunity.
Sure. So Clarence and I are going to spend some time really having just a conversation and a dialogue with you. We're going to have a little bit of an experiential experience for you for like the first 15 minutes, and then we're really just going to dive in and talk as a team about some of those individual strategies that you may be using and just sharing with one another.
Okay, great. Nate, if you want to add anything more.
Yeah, we're going to be talking about a total worker health approach to really kind of transforming that school level and an organizational culture towards one that's facilitative of mental well-being.
All right. Well, I want to thank my panel not only for their good advice, but also because they kept on time, followed directions very well, and we wanted to end just a minute or two earlier so that we keep you on schedule.